Welcome back to CBS This Morning. We could soon get a clearer picture of the devastating toll the pandemic has had on nursing homes. More than 15,000 nursing homes had to submit their first reports on coronavirus deaths and infections to the federal government by last night. CBS News has confirmed that of the more than 89,000 deaths from the coronavirus, more than 28,000 were connected to nursing homes, nearly a third of the total. As Jonathan Vigliotti reports, a lack of staff could have made the problem worse.
I feel like I'm lying to him when I tell him I'm going to see him soon. You know, I feel like because I have to say that to him so he doesn't give up.
Lisa Cook's husband, Bruce, who suffered 2 strokes, is recovering at the Stony Point Healthcare Center near Los Angeles.
Pet your babies, Bruce.
Before coronavirus, she says Bruce had made progress through months of speech and physical therapy. Cook is now worried he's declining, and she's concerned about his care.
The actual caregivers there are my angels, I call them. But they don't have time to look after him the way, they don't have the time. Bruce is absolutely at their mercy.
At least 14 Stony Point residents and 8 staff members have tested positive for COVID-19. California advocates for nursing home reform filed a complaint with the state about conditions at the facility during the outbreak. A report issued by the California Department of Public Health found a deficiency in infection prevention and control, including a nurse entering a resident's isolation room without wearing PPE and then grabbing a cart without cleaning his or her hands.
How does that make you feel to know that this is a place that is supposed to be taking care of your husband?
It makes me mad. And it makes me scared because that's unacceptable. But I know it probably happens because they're overworked and understaffed.
The Centers for Medicare and Medicaid Services gave Stony Point a below-average rating for staffing. Mike Dark is an attorney with California Advocates for Nursing Home Reform.
Understaffing is really the original sin of the nursing home industry in that so many other problems like neglect, like infection control, really stem from it. And that was the case long before this virus showed up.
There are no federal regulations on staffing levels, but federally certified nursing homes are required to have a licensed nurse on duty. CBS News found that roughly 1 in 15 U.S. nursing homes was cited last year for failing to meet standards for sufficient nursing staff. Now the outbreak, which has sickened workers and prompted others to stay at home, is hurting staffing levels even more.
What we've heard from our members about staffing since the pandemic is that the conditions are far worse than they ever have been.
April Verrett is president of SEIU Local 2015, California's largest union, which represents 1/4 of the state's nursing home workers. Verrett says the median salary for nursing home workers is about $23,000 a year. Advocates say operators need to increase pay and hire more employees. They also want the family members to be allowed back if they've been tested and have proper PPE.
For him to recover, or any other patient that's in there, or to stay well, they have to have their families there. They absolutely do, and there's got to be a way.
And we reached out to Stony Point about the inspection report. The facility said, "We take such reports seriously," and this one was no exception. And I quote, "We took immediate corrective action upon receiving the notice and instilled additional training for all staff members on proper infection control procedures." The facility says they have an unwavering commitment to provide the highest level of care. Lisa Cook, who you heard from there, she says that should include allowing families back into nursing homes. Gail?
Boy, we feel for Lisa Cook. Jonathan, I see why she's mad and scared. We're pulling for Bruce and everybody else in that situation. Thank you very much.